Hey, how you doing? I'm USMC Doc 14 from Pirate 4x4 and JKOwners.com, and today we're going to be teaching some different medical techniques. I've had a bunch of requests from some of the guys in the different forums wanting me to show them some basic field medical maneuvers. Even though I am a trained medical professional, the techniques that are going to be shown here are just for educational purposes. Please attend formal training on your own. So that you can become proficient in any of it. This is just for general information use only. The first thing we're going to teach today is the proper use of a tourniquet. Now, in civilian EMS, which I did prior to joining the military, the tourniquet is a big frowned on thing because it was very thought to inflict neurovascular damages, gangrene, stuff like that. So it was shied away from. Even early in my military career, the stigma of that being placed on it made the tourniquet really touchy subject, when in reality, tourniquets are not that damaging. When we do surgical procedure, for example, if we were to go and do a knee replacement, we'd actually place a tourniquet up here to create a bloodless field in the lower part of the leg, and that's for hours on end. Now, the major damages that happen when utilizing a tourniquet are actually nerve damages and muscle damages, because instead of using a wide band tourniquet, like what we'd use for, like surgical procedures, you're actually using a narrow band tourniquet. Now, tourniquets are used for one purpose and one purpose only, and that is to stop uncontrollable arterial bleeding. Okay, if you don't know what arterial bleeding looks like, the first time you see it, you will go in your mind or out loud, holy fuck. Okay, it's not anything like any sort of cut you've ever gotten before. At this distance, if it was a femoral artery bleed, I would be getting sprayed in the face. It's obscene amount of blood, an obscene amount of pressure. The steps for controlling all bleeding, first things first, is put pressure on the wound. Okay. The next thing, of course, use some sort of other gauze or whatever placed on the wound, and also pressure on the wound. You see a theme here? It's always pressure on the wound. Now, we're going to skip over the pre-steps and just get straight up into the tourniquet application and use. For this example, we're going to assume that the patient has an arterial bleed from just above the knee area. Now, the tourniquet, you don't want to place directly over where the wound site is. So if it was like here, you'd actually want to place it above it. Hands width, just above it, okay? Tourniquets are only to be used on limbs. Now, if you went and you had an arterial bleed from up here in the pelvic region, you can't put a tourniquet here because you can't tourniquet up this high. That's for different hemostatic agents, and we'll get into that in a different video. Right now, we're just going to stick with the basics of an uncontrollable arterial bleed in a lower extremity, and basically how to apply a tourniquet. Now, first things first, let me go and show you the tourniquets. These are actual issue tourniquets. This is a CAT tourniquet from North American Rescue. Self-contained. The black one is, for actual use. The blue one that we have here is for training, and we'll be using this because it, better matches the skin tone of my patient. The blue, black, blue. When you get them, the neat thing about it is they come with instructions, and most people have a tendency to throw these away and assume that they know how a tourniquet works. Okay, and the things that are written in red in the instructions are actually the important shit that you need to know. Okay, and we'll cover this in detail. Now, so before you even use one of these, you should really finger fuck it and see how it works. It's actually a very simple process. You got Velcro band, you got a little buckle thing here, and inside this wider band is a thinner nylon band like this that's allowed to free slip into it. So when you tension up the strap, it constricts this down tight. You actually want a tourniquet that is reasonably wide, and that's for two reasons. One, it it does less damage to your patient, and it also allows, because you are really not going to be pressing the tourniquet directly up against the arterial bleed. The femoral, most of your arteries are right next to the bone, so you're actually going to be pressing all the musculature to clench around it and to stop the bleeding. This right here, this part is your windlass. This right here is your little clippy thing for when you tighten the windlass to slip it under. And this right here says time. Now, the civilians are really hardcore about writing the time on it. And military as well, but we definitely with civilian protocols are really stickler on time. If you have a Sharpie or something, write down the time that you put it on there. This way the surgeons, when you get them, have an idea of how long this tourniquet has been applied to the limb, and then they can take other measures to prevent more damage. Application is really easy. You can either completely take this out, slide it around the leg, okay, or around the arm, or you can leave it threaded through and go all the way down to the foot and then all the way up. Personal preference. I mean, each different place is going to have a different SOP, a different protocol. But we're going to be using this training one. Now, the first things first is if we're going to assume the patient has an uncontrollable arterial bleed. Now, I would apply pressure. Now, if you notice something here, I need 2 hands to operate a tourniquet. So this shit isn't going to work. Your patient probably is not going to be able to apply enough pressure on their leg in order to occlude the bleeding. So, nifty little trick, kneel on it. Take your knee, and I'm not going to actually do it because it does hurt. Take your knee, put it directly on there, and put your entire fucking weight down on where the bleeding is coming from. Now, I got both hands free. Ta-da! Okay, so first things I'm going to do is apply pressure to the wound. Now, what you can do is you can also go and utilize different pressure points of where the artery runs close to the bone to stop it. In this location, that's probably not going to happen. There's a lot of musculature in the thigh that you're going to have to get through in order to get to that. So, I'm kneeling on my patient. I'm blocking the hole. Whip out my tourniquet, okay? Now, since I'm kneeling on the patient, I can't slip this around them, can I? So, go and take it, pass it under the leg, okay? And pass it through the first part of the buckle, okay? And cinch it down. Then pass it back through the buckle, okay? You see that, right? That prevents this from slipping. You actually have to put a shit ton of force on a thigh in order to occlude the bleeding, okay? This is the biggest mistake people do, is they actually half-ass applying a tourniquet. Now, I'm not going to crank it down on my patient because it'll hurt, okay? I mean, I shit you not, it will fucking hurt. What you can do is, the main thing you want to pay attention to when applying a tourniquet is you do not stop until the bleeding stops, okay? Your patient can scream and bitch and yell all they want, but what would what would they rather be? Dead and quiet or alive and screaming? Tough call, huh? Okay, tighten this up, then you're going to go and pull out the slack in the windlass, okay? As I'm just going like this, pulling it tight. And then you're going to crank the windlass down. Now, I'm just snugging it up so it doesn't move. But you would continue to crank this windlass until the bleeding stopped. Okay? No more bleeding. You can stop. Still bleeding. Keep fucking cranking it. Okay? Yes, it's going to be a lot. Yes, you are really going to be tightening this thing the fuck down. Okay? Be careful with the cat tourniquets. Okay, first generation cat tourniquets is a problem of the windlass actually snapping. That's how much pressure you're going to be applying to occlude off the bleeding. Another thing you can do is you can check for a distal pulse further down from where your wound site is, and see if there's a pulse going on. No pulse, good to go. But don't worry about that. Don't nuke it. No more bleeding, no more tightening. Still bleeding, still tightening. Once you get it cranked the fuck down, it doesn't matter if you go left or right, that's why these are hooked on both directions, you take the windlass and you stuff it up underneath there. And you Velcro it in place. That's it, okay? Don't fuck with it, okay? If you got advanced medical training, yeah, there's some techniques of loosening it and trying to occlude this off and what it, don't fuck with it, okay? You as an average civilian, once you put this bitch on, leave it the fuck alone, okay? People are, oh my God, they're going to lose their leg. Okay, what would you rather be? Dead or have a stub? I can gladly live without a leg, okay? If that meant the difference between me having the leg and making a great body, okay, or being alive and having a stub. Not that difficult of a choice, okay? Life over limb. Now, that's with the CAD tourniquet. The other thing is improvised tourniquets, okay? Now, it's kind of fucked up, but a lot of you never went through Cub Scouts or Boy Scouts or any of that first aid shit for, you know, for wilderness medicine. So you have absolutely no clue that you do not need a nifty cat tourniquet in order to create one. Now, some people are like, well, I can just use my belt. Okay, well, belts are cute and all, but try twisting a windlass on a belt, okay? It doesn't happen, okay? It's too fucking wide. It's too heavy. And now you can use rope, but the problem with rope is, it's really going to cut in there, okay? And if you're using skinny rope, it'll actually cut the flesh before it even includes off the blood vessel. Adapt and improvise, okay? Anything can be used as a tourniquet. If it's cloth and it's strong enough, okay, it can be used, okay? I can go and whip off one of my fucking socks right now, tie that bitch around here, okay? Stick a windlass through, crank it down, and it'll work, okay? You should have 90% of what I'm going to be showing you guys, you can accomplish with a pocket knife and what your patient is wearing. Well, not necessarily what my patient is wearing, but what your normal patient is wearing. Okay, now, this is the good old standby, okay? This is a triangular bandage. Okay, these bitches have been in use for who the fuck knows how long. This thing was probably made in Vietnam, Europe. These can be picked up at mill surplus places for $1 a piece or whatever, eBay. Okay, it's muslin bandage. Fold it nice and tight. Comes with some safety pins. The main thing is, look at that. It's already a fucking tourniquet. Okay? Now, if I unfolded it completely, it would be triangular shape. And they make really nice bandanas, and that's what most of your Marines will steal them from you to make into. Okay, so, this is now my tourniquet. Same thing. Kneeling on the bleeding spot, holding it in place. Take my improvised tourniquet. Now, I'm going to tie a square knot, okay? Left over right. Right over left. Don't worry about this shit. If you can't tie knots, tie lots, okay? Plain and simple. Now, you might be immediately tempted to go and take and put your windlass right here in the middle of the knot. Don't do that. That's actually kind of important because this will secure your windlass once you're done. Now, for your windlass, you can use anything. Hunk of metal, okay? 50 cal round. Stick, whatever. Remember, whatever you're going to use has to be strong enough for you to twist it around. Think, look around. Anything that's a metal bar or a bar of something you can stick in there. Your environment will give you clues as to what you can use. Now, like I said, look around. Now, the environment that I'm in right now, of course, is the bedroom. So what the fuck do I have that I can stick in as a windlass? Grab the first thing that you can think of, okay? Stick it in there, crank it down, okay? Now, the thing you have to pay attention to is this is going to pinch the skin, okay? Once again, pain versus death. We used to go and stick stuff up underneath here and stuff like that, okay? So that it would tighten down and it wouldn't pinch the skin. Whatever. Just crank the bitch down till the bleeding stops. Now, once you get it cranked down, this is where your knot comes in play. Make sure your windlass is long enough, okay? And then you go and you tie this around. like that. And now it's secured my windlass. It's preventing it from unraveling. And the bleeding has stopped. And that's about it. I mean, you know, that's about it for, you know, for commercially available. I mean, there's tons and tons and tons of commercially available tourniquets out there. Whatever you get, please practice with and screw around with and use. And also remember that you can improvise, that you can use anything if need be. But the most important thing is, you know, life over limb. Okay, well, I'll set up for some other more videos, but thank you guys very much for watching, and have a good night.